بس خلاص. بسم الله الرحمن الرحيم. في البداية طبعا أشكر الأستاذ الدكتور هشام الشيخ رئيس مجلس قسم الأشعة واللجنة المنظمة وعلى الدعوة الكريمة. ونبدأ التوك. ريست الدكتور أحمد البحيري طبعا اسكندرية، أستاذ بروفيسور من اسكندرية ومن الناس الممتازة هناك. البيبر التوك resting state function MRI in children with autism.
بسم الله الرحمن الرحيم. اولا اشكر اللجنه المنظمه واستاذ دكتور هشام واستاذ دكتور رجب على اختيار البرزنتيشن ان هي تشارك في السيشن الرائعه دي. بسم الله. My presentation is entitled Resting State fMRI in Children with Autism. In order to understand the role of fMRI in autism, I'll pass through three main topics. First of all, general idea about brain functional MRI, followed by focusing on what is known as resting state fMRI, and ending by the role of resting state in children with autism. As regards functional MRI, I'll mention 5 main points. What is meant by functional MRI? What is its basic principle? What are the 2 types of brain functional MRI? Ending by the indications and the limitations of the older technique, which is known as task-based or paradigm-based fMRI. Functional MRI of the brain is a gradient or T2 star-based technique which makes it possible to detect what is known as functional areas in the brain, like the elegant cortex or the functional networks. The main principle of fMRI, whether task-based or resting-based, is known as the BOLD technique, which stands for blood oxygenation level dependent technique. This means that in any neural activity there is increase in the cerebral blood flow, and this leads to increase in the oxyhemoglobin and wash out of the deoxyhemoglobin. This imbalance between oxy and deoxyhemoglobin will lead to drop in signal on the gradient, and this is detected as functional area. We have 2 main types, the older technique known as task or paradigm-based fMRI and the more recent technique known as resting state fMRI. In task-based, the patient is entering the MRI machine and he is asked to do certain tasks, like for example, moving his foot, moving his fingers, his lips, or his tongue. And here we are examining the elegant cortex responsible for these tasks. Or he is entering the machine and he is asked to listen to certain word or to repeat certain words several times. And here we are examining either Wernicke's area, which is the receptive language, or Broca's area, which is the expressive language. The main indication of the task-based is for preoperative planning, like this patient which had space-occupying lesion on the right side, in the right perisylvian region. He was left-handed, but on doing task-based fMRI, the Broca's area was on the contralateral side, which means that he was safe to be operated upon. But unfortunately, the task-based fMRI has certain limitations, the most important of which is that it needs best cooperative patient. So it cannot be done in children, cannot be done in uncooperative, claustrophobic, aphasic, or paretic patients. Besides that, some functional areas in the brain, like for example, the dorsal and ventral attention networks, has difficult to perform tasks. So here comes the more recent technique, which is known as resting state fMRI. Before going into the role of resting state in autism, I'll mention 3 main parts or 3 main points. Some facts about the brain at rest, followed by the technique of resting state fMRI, and ending by the indications and the applications of resting state. What is meant by brain at rest? This means any child, any teenager, any adult who is either sleeping or daydreaming. This is the brain at rest. The first fact that brain never rests. Under normal physiological conditions and under normal resting, the brain is always active, and this is evident by sleep EEG, which shows electrical activity, and PET, which shows metabolic activity. And that's because the brain under normal resting conditions is always receiving about 20% of the cardiac output, which means 20% of the body's energy is going to the brain. 95% of this huge amount of energy is used by the brain under resting condition, and this is known as intrinsic brain activity. Just 5% only is used for any task-related activity. This intrinsic activity is again used by the brain to connect different areas in the brain, and this is known as functional connectivity. The aim of this functional connectivity is to maintain information inside the brain, keeping it always ready for any environmental demands. And here comes the last terminology in this part, which is known as resting state networks. These networks are anatomically away from each other, but they are connected functionally, and this is the main target of resting state fMRI. As regards the technique of this resting state, it is divided into three main parts: data acquisition, followed by post-processing and interpretation. As regards data acquisition, it should be done on closed, of course, magnet. 3 Tesla is better than 1.5. The patient is completely sedated, and the technique is gradient echoplanar imaging sequence. This covers the brain, the entire brain, in 2 seconds, and this is repeated 200 times, so the sequence takes about from 5 to 7 minutes. This is followed by data processing, and this, of course, needs dedicated software, like, for example, the free server or the FSL, to get what is known as resting state networks. The master of the resting state network is known as DMN, or default mode network. Anatomically, it is located within the medial prefrontal cortex, the posterior cingulate, as well as the precuneus. This network is dedicated for thinking about oneself, thinking about others, mind wandering, and social interaction. When this function occurs in these networks, this will lead to social communication deficit. We have what is known as attention networks. Ventral attention network, from its name, it is located within the anterior cingulate, while the dorsal attention is located within the intraparietal sulcus. Their main function is for attention and orientation, and again, this function will lead to attention deficit. We have language-related networks like Wernicke's network, which is located in the posterior aspect of the superior temporal gyrus, and this is receptive language. And we have Broca's network located within the inferior frontal gyrus and responsible for expressive language. This function here will lead to language processing disorder. Lastly, we have networks related to special senses, like the auditory network located within the mid aspect of the superior temporal gyrus, and the visual network within the occipital lobe. Again, here this function will lead to either auditory processing or visual processing disorders. The last part is interpretation of results. We compare the results of resting state of the patient with control of typically developing children to know if it is normal functioning or hyper-functioning or hypo-functioning. This is summary to the difference between the resting state network or the resting state fMRI, where the patient is completely sedated and we are just examining activity and connectivity of networks, compared to the task-based, where the patient is cooperative and actively participating, and here we are examining the dominance of the elegant cortex. As regards the clinical applications of resting state, it is used preoperatively in brain tumors, in uncooperative patients, in epilepsy, in neuropsychiatric disorders like autism, and in neurodegenerative diseases like Alzheimer. Today we are just speaking about the role of resting state in autism. I'll mention 4 main points. What is autism? What is its definition? Why do we care about autism? What is the role of brain imaging in autism? And lastly, what is the role of resting state in children with autism? Autism is a spectrum characterized by 3 main features: impaired social interaction, communication deficit, whether verbally or non-verbally, as well as repetitive pattern of behavior. Why do we care about autism? Because unfortunately, the prevalence of autism is dramatically increasing. In the United States, for example, according to the CDC, in the year 2000, the prevalence was 1 in every 500 children. In 2023, it reached 1 to every 36 children. According to the WHO, all over the world, 1 in every 100 children is affected by autism, which makes it the fastest growing neurodevelopmental disorder. And sometimes pediatric neurologists are asking, are we facing an epidemic of autism? So from the radiological point of view, does brain imaging diagnose autism? The answer is no. ASD, or autism spectrum disorder, is completely a clinical diagnosis based on checklist observations and questionnaire. So the second question, can brain imaging diagnose the etiology or the cause of autism? Again, the answer is no, as apart from some cases of tuberous sclerosis and NF1, most of brain imaging, structural brain imaging, is completely normal, because etiology of autism is a combination of genetic factors and environmental factors. So how could brain imaging help in this condition? Autism is like a mountain of ice, where the tip of this mountain is usually normal on structural imaging, while most of the abnormality needs dedicated advanced imaging like volumetry, diffusion tensor imaging, as well as resting state fMRI, which leads to seeing the unseen. The main role of resting state in autism is tailoring the management plan. To understand what is meant by tailoring, we will go through cases. These are two children with autism and poor verbal communication. The first child, these are the resting networks compared to control. He has what is known as hyperactivity or hyperfunction of the auditory networks, which means that this child is receiving too much auditory stimuli. He cannot mask the unwanted noise. And that's why he is covering his ears and he retreats from the environment and becomes autistic. This is known as auditory processing disorder. Based on resting state fMRI, the management was what is known as auditory integration therapy, which means that he is listening to voices with certain frequency to get him accustomed to these voices or to these sounds. While the second child was presenting with autism and also poor verbal communication, these are the resting state networks compared to control. He has hypofunctioning or hypoactivation of Vernix network. Vernix is the receptive language. This means that he can hear, but he cannot interpret what is heard. He cannot understand what is heard, and this leads to loss of communication and autistic behavior. This is known as language processing disorder. It is different from auditory processing disorder. And the management plan for language processing disorder is speech therapy. So based on resting state, the two children with the same manifestations, the first was diagnosed as auditory processing disorder and the second as language processing. The management for the first was auditory integration therapy and for the second was speech therapy. Here we have another two children with autism and repetitive pattern of behavior. These were the resting state networks compared to control. This child had hyperfunctioning or hyperactivation of the sensory network, which means that he is receiving too much sensory stimuli. This leads to what is known as traffic jam in the brain. This child tries to avoid these too much sensory stimuli by becoming an avoider personality. Avoider sensory processing disorder. He becomes picky eater. He becomes non-touchable. He always cries when he is touched. Based on resting state fMRI diagnosing him as avoider, the management is known as sensory integration therapy. It aims to desensitize this child by reducing the colors of the surrounding environment and indulging him in physical training to get him accustomed to sensory stimuli. While the second child was also presenting with autism and repetitive pattern of behavior, the resting state networks here show the opposite. It shows hypoactivation of the sensory networks, which means that he is receiving too little information. And that's why this child is trying to get this information by becoming a seeker personality. Seeker is the type of sensory processing disorder where this child is always jumping, spinning, constantly touching people in order to get more sensory stimuli. Based on resting state fMRI and its diagnosis, the sensory integration therapy here was different. It was aiming at increasing the proprioceptive sensation, increasing the colors of the surrounding of this child, and indulging him in activities in order to increase his vestibular input. So again, resting state diagnosed the first child as avoider and the second child as seeker sensory processing disorder, which gave objective evidence for sensory integration therapy. Lastly, the most post-management follow-up. Here we can see the difference between the DMN, or the default mode network, prior to therapy in the first row, and 10 weeks after neurorehabilitation, you can see increase in the signal intensity and the volume of the components of the DMN. So to conclude, no two autistic children are the same. Resting state fMRI is considered to be the fingerprint for each autistic child, which makes it a new cornerstone in management plan for children with autism spectrum disorder. Thank you.